Is up? It's still loading on my screen. Okay, we are live. So welcome everyone to the first lecture of the 10 seconds till we start. Great. So welcome everyone to the first lecture in our fall 2024 Climate and Health Lecture Series, co-sponsored by the Idaho Clinicians for Climate and Health, St. Luke's Sustainability Program, and Community Health. We have a very timely, interesting lecture today with two great speakers. They're going to talk to us about wildfire smoke and its impact on community and human health. We have an outstanding fall series that will take place once a month, every month from now until December. We have some talkers about sustainability in healthcare hospital design from the Ohio State University, and a speaker from St. Luke's talking about what we're doing at our new downtown construction improvement project, following the Boise Green Code. That's in September. In October, we'll have speakers from Boston Medical Center talking about their clean power prescription program, how they're using solar power to help low-income community members have access to clean renewable energy, and also talk about their rooftop garden, which we're hoping to model at St. Luke's. In November, we're going to have a speaker from the University of San Francisco talk about plastics in healthcare and how much waste we generate and some strategies we can use to reduce our plastic waste. And then in December, our capstone will be with Bill McKibben, and we'll have a book club for the St. Luke's Green team around one of Bill's books, talking about his lifetime in climate action. So first, today we have Dr. Moji Sadegh. Moji is a friend and colleague from Boise State University. Moji is an associate professor of civil engineering, a civil and environmental engineer by training, and a climatologist by passion. He received his PhD in civil and environmental engineering from the University of California, Irvine in 2015, and uses geospatial analysis, machine learning, statistical methods, and data fusion and integration techniques, as well as satellite and airborne imagery and products, climate reanalysis data, gridded and in situ observations, and socioeconomic data to unravel mechanisms that drive climate extremes and their societal impacts. I'm excited to welcome Dr. Moji Sadegh to lead us off on our discussion about climate and health today.
Thank you so much, Dr. Sims. Let me go ahead and share my screen, and there we go. Do you see my screen now? Do you see my screen?
Yes.
Okay, perfect. All right. So thanks for having me today. I would like to talk about, well, my title is an era of climate extremes, trends, and impacts. So I would be remiss if I don't start with what happens with smoke right now in Boise and where the smoke is coming from, right? So if this is just for August 9 and 10th, as you can see, we get smoke in Boise and in Idaho in general. But we get smoke from California, the Park Fire. We get smoke from the Durkee Fire, which is less active right now. We get smoke from all the fires that are happening in central Idaho and everywhere, right? So we get so much of that. And another really impactful extreme that I always include in my talks when I'm in Northwest is the 2021 heat dome in Oregon, Washington, and British Columbia. So what happened in 21, late June, mid-July, till mid-July, was that the air temperature was up to 15 degrees Celsius. That's 27 degrees Fahrenheit, was warmer than their normal temperatures. And if you look at the weekly death rates in Washington and Oregon, we see that at the week of the heat wave, the death rate was a lot higher than the largest rate of deaths during COVID surge. And so this was a lot more pronounced in Washington, but also in Oregon, we had a really big peak. And overall in Oregon, Washington, and British Columbia, more than 1,400 people died because of this heat wave. So far in 2024, we have had 19 separate billion-dollar disaster events, and this is only August. So usually a lot of the disastrous wildfires that happen in the West occur in the fall. So I'm hoping that we don't have any this fall, but we don't know until we have the first wetting precipitation that occurs. If we look at the trends of the billion-dollar disaster, and for those of you who have heard my talks before, you probably have seen this slide over and over. It's just getting updated because every year we've got more and more. If we look at the number of billion-dollar disasters from the 80s all the way to 24, you see this is increasing. So that's on the y-axis on the left. If we look at the cost in billions, that's also increasing. So far in 24, we had more than $400 billion losses due to various climate-related disasters. Now, what's happening? What is causing all these disasters or climate-related disasters to occur? Obviously, climate change has a big role, a major role playing in all of this. And, you know, one of the signals of climate change is the background warming. We know across the United States, across the contiguous United States, since the beginning of the 20th century, annual average temperature increased by 1.8 degrees Fahrenheit. And you might argue that 1.8 degrees Fahrenheit might not be that much, but what I would really like to discuss with you is this distribution of temperatures. So if we look at the previous climate, looked like this, and then the new climate, so the average has gone up 1.8 degrees Fahrenheit. So it's gone from here to here. And now let's look at the tails. Is the chat for me? No. Look at the tails, right? So where the limit for the hot temperatures is, with the previous climate, we had this much probability of a hot day occurring. Now, with the new climate, you can see that the probability, the area under the curve has increased really, really higher, to a higher level. And if you look at really, really hot days, like those 2021 extreme events, the extreme heat, what you see here that the probability was really low, almost nothing with the previous climate. But now we have this area of probability for such an event to occur. So that's why we have a lot more unprecedented events, because this tail, just a little move here in the average has a big increase in the tail, which is what's happening right now. Now, climate-related disasters from 1998 to 2017 have caused the loss of more than $2,245 billion across the globe. That's 151% growth in 20 years. So basically in year 2017, we have 2.5 times more disasters, both in terms of frequency and cost, than 1998 across the US. That's causing a lot of impacts, from longer heat wave seasons and larger heat waves, to more heavy precipitation, to lower snowpack, worse drought conditions, less sea ice content, increasing sea levels, ocean acidity is increasing, wildfires are becoming more and more prevalent or disastrous across the US. I will focus on heat, wildfires, and wildfire smoke because our area is most frequently impacted by them. So across the globe, just from the excessive heat, it's estimated that between 1998 and 2017, more than 166,000 people lost their lives due to heat waves. Heat waves are prolonged periods of excessive heat. Like we had 2-3 weeks of more than 100 degrees Fahrenheit in Boise this summer. That's called that's called a heat wave. But if one day it goes up 100 degrees and the next day drops down, that's not a heat wave. If we look at the number of heat wave days across the globe, so across the globe, in each continent, we calculated using climate data, what is the number of heat wave days in each year, in each decade? So average in each decade. What you see in orange is the number of heat wave days, and what you see in red is the number of people that were exposed to heat waves in each continent. Now, most number of heat wave days are increasing in all continents, and also the people exposed to heat waves are also increasing. Number of heat wave days has increased by 60% in the past 4 decades across the globe. Mean heat wave season lengths also increased by 75%. So if you had a 30-day season between the first heat wave and the last heat wave, now we have 51 days between the two. Exposure to heat waves has increased 65% from 2000 to 2010. So we went from 5.6 billion person days, so that's number of people times number of days, to 9.3 billion person days globally in the number of exposures to heat waves. Now, if we look at each cluster of income, so if we break down the entire globe into 4 quarters of income level, going from high income to low income, what we have seen is that the number of heat wave days in low income quarter of the world is 30% more than the high income. So those that are more vulnerable are already exposed a lot more. And also the number of exposures was 40% higher in the poorest region. Now, why this is important? Because I just talked with, like last week, I was talking with an Associate Press reporter in Morocco, that during a heat wave, they lost electricity in a hospital, which caused 22 deaths. Now, that's very rare in the US, right? Because we have all sorts of adaptation mechanisms in place, and our hospitals are more equipped and all those stuff. So that's just one example of why this is important to look at different income levels when we are talking about all these climate disasters. Now, if we look into the future, what we know, and looking into the future, we also included adaptation capacity that's also dependent on income. So if we consider both the climate trends and adaptation capacity, what we see is the number of heat waves is expected to increase. These are the 4 clusters of income. This is the lowest income, this is the highest income. And we are going from the 2030s all the way to the 2090s. So the number of heat wave days are expected to increase in all income clusters of the world, but in the lowest income cluster, both the rate of increase is a lot higher, and also the baseline. So the number of heat wave days is a lot higher by the end of the century in low income regions compared to the high income region. And also similar trend exists for exposure. So exposure is increasing in all income clusters, but a lot more for the lowest income cluster. Now, what we have estimated is that by the end of the century, the number of people that are exposed in the lowest income quarter of the world is expected to be similar to the 3 quarters combined, which is very concerning, obviously. Now, there are health impacts associated with smoke. As I mentioned before, 166,000 people have died already from 1998 to 2017 globally due to heat waves. There have been several really impactful heat waves in the US. One was the Chicago heat wave of 1995 that is estimated to have killed more than 700 people. In the Northwest 2021, we had more than 1,400 deaths due to heat waves. Deaths occur due to heat stroke, but also because of worsening the background conditions like cardiovascular diseases, respiratory diseases, etc. And then we have a lot of hospitals admissions due to heat waves because of cardiovascular, kidney, and respiratory disorders that are worsened by heat waves. And Dr. Rabin will talk a lot more about these health impacts in the next 20 minutes. Well, after I finish. Now, moving from heat waves to wildfires, and also moving from global scale to the US scale, and then we are going to move down to Northwest, and then we are going to move down to Idaho as we go through. In a study, we looked into how many people have been exposed to wildfires in the past 2 decades in the US. Primary population means the number of people that lived within the boundary of a large fire across the US was nearly 600,000 people in the past 2 decades in the US. So from 2000 to 2019, 600,000 people across the US, across the contiguous US, lived within the, or had residence within the boundary of wildfires. 82% of them occurred in the Western US. And if we look at the secondary exposure, so this is within 3 miles from a fire. So this is where the evacuation zone is. This is where we get all the thick smoke and all those stuff. This number increases by 36. So we have 21 million Americans finding themselves within 3 miles of a large fire between 2000 and 2019. Obviously, that's a really, really large number. If we look at the trends of exposure to wildfires, primary exposures, those that live within the boundary of fire, have increased by 1,200 people per year across the contiguous US. So each year, an additional 1,200 people are exposed to wildfires. That's 125% growth in 2 decades. This is mainly driven by the trends in the Western US, which we see an increase of 85% of primary exposure to wildfires. That's 1,250 people per year increase. So basically what we have this year, we know that next year, another 1,240 people will be exposed. So that's a little town. Obviously in Idaho, we have towns that are much smaller, or the population is much less than 1,200 people. So basically we have a couple of little towns every year exposed to wildfire that were not exposed in the previous year. California accounted for a majority of the trend. But also, as I mentioned before, income has a big impact in how people has a big effect in how people are impacted by these extremes. So what we did here in California, Oregon, and Washington, which are disproportionately impacted by wildfires, we also looked into the background vulnerability of the people that were exposed to wildfires. And then we have low vulnerability, medium low, medium high, and high vulnerability. So what I'm really interested in is this percentage of the people that are highly vulnerable and also were exposed to wildfires. Now, vulnerability is coming from income. So low income, high vulnerability, right? So it's coming from minority status, it's coming from tribal status, it's coming from rural versus urban status, it's coming from the housing that people have. And the higher vulnerability means that people have lower adaptation capacity, means that they cannot cope with fire as other people or low vulnerability people do. So when an evacuation order comes in, those that are wealthy have cars, they can book a hotel room, etc. They move really fast, and those that don't have cars or are disabled or they have other vulnerability or background vulnerabilities have a little harder time evacuating. So the impact on those higher vulnerability people are going to be a lot larger. Now, if we look at the recent decade, we see that in California, that's only 11% of the people that were exposed to wildfires had the highest vulnerability. Now, that 11% percentage-wise, that's not much, but the number of people is really huge in that category. But if you look at Oregon and Washington that are more closely, or they have more close similarities with Idaho, you see almost half of the people that were exposed to wildfires also had high background vulnerabilities, which is really concerning given they cannot respond to wildfires as lower vulnerability people do. Now, in a project that we are working on right now, Healthy Idaho project that Dr. Sims and other colleagues from from St. Luke's are involved. We are looking into whether we see a change in mortality rate after these wildfire disasters occur. Now, what you see here, this is very preliminary. This is mortality rate in Maricopa County in Arizona. And you see there is variability from months to months, and then there is seasonal variability in the mortality rate. And as you can see, this is the COVID era that the mortality rate really increased a lot. But what you see here, these red dots, is where wildfires destroyed structures in this county. And when we look at them, we see like this wildfire. If you look at the previous months, we see a much larger increase in the number of death rates in this county. Now, whether this is a signal or just a noise, our study is really preliminary. We can't say, but what we see for a fact is that in several counties, and that doesn't apply to all counties across the U.S., but in several counties we see persistent higher death rates after a wildfire disaster occurs. So stay tuned. We are going to conduct this research and report back to you. Now, moving on to wildfire smoke. Across the West, wildfire smoke has always been an issue. Obviously, if you look at 2006 to 2008, the smoke load has been high in the West, but not only we have a lot more smoke, but we have a lot higher coverage of a smoke across the West. Now, this is air quality index in Boise, Idaho. We have green, that's good air quality, all the way to red, that's unhealthy, purple, that's very unhealthy, and maroon, that is hazardous. If we look at June through September, that's the wildfire season, we see that we in the earlier years, so this each row is 1 year, each column is 1 day of 1 month. If we look at the wildfire season, we see that we used to have a lot less poor air quality. We have a lot more now. And then 2024, you see that we have a lot of unhealthy days and a few very unhealthy days. Now, in the interest of time, I might just skip through the couple of slides that's left, just mentioning that what we know about all these smoke exposures is that we have some respiratory symptoms like coughing and wheezing and all those stuff. There's some effects like bronchitis, reduced lung function, exacerbation of asthma, and then we have also cardiovascular effects like heart failure, heart attack, and stroke. We did a survey in Idaho in 2017 after that big smoke year, and a lot of people that we interviewed reported that they have wheezing and whistling in their chest, they have itchy, watery eyes, they have irritated eyes, they have sneezing, blocked nose, sore throat, and they reported a lot of headaches. And with that, thank you so much. I will give the floor to Dr. Rabin, who will talk about health impacts of wildfire smoke and other extremes, and I'm also very excited to hear what he has to share.
Thank you so much, Dr. Sadegh. So up next, we have Dr. Alex Rabin. He is a clinical assistant professor of pulmonary and critical care medicine at the University of Michigan. The goal of his work has been to understand the health effects of air pollution and climate change on patients with respiratory disease and minimize the environmental impact of healthcare delivery through research, education, and advocacy. His current project, titled VA Switch, is investigating the relative clinical effectiveness and greenhouse gas emissions of meter dose versus dry powder inhalers, a topic we've discussed here previously with one of Dr. Rabin's colleagues, Dr. Greg Curie, and that lecture is posted on our YouTube site. So if you're interested, check out the St. Luke's YouTube page and you can see those previous lectures. Dr. Rabin's writing has been featured in the New York Times and the LA Times. He is a fellow Emory, which means he's a graduate of the Emory University School of Medicine like me, and completed his medical training at Brigham and Women's Hospital and Massachusetts General Hospital. Please welcome Dr. Alex Rabin.
Okay, sorry, I'm having some minor technical issues. Give me 1 second. Does that look okay?
It does. And just one quick pointer, anyone who's got questions, please keep posting them in the chat. We'll let Dr. Rabin get through his talk, and then we'll do a question and answer session when he's done.
Thanks so much for the kind intro, Ethan, and thanks for having me alongside Dr. Sadegh. It's great to join you guys from Ann Arbor here in Michigan, where fortunately today the air is pretty clear. But I'm very much empathize with all of you in Idaho and for what you're going through this summer, as you've gone through many summers before. Just briefly, I want to mention that I'm an employee of the U.S. Department of Veterans Affairs, and some of the work that I will be presenting is supported by a grant from the VA. I don't have any other relevant financial conflicts of interest. So as Dr. Sadegh, I think, nicely outlined really the global impacts of wildfires, it is clear that with increased warming globally and increased droughts in certain regions, and in general, larger weather extremes, we are seeing wildfires explode here in the Western United States and Canada, and really around the world. And that poses really a major threat to human health for all citizens of Earth, I would say. And really what happened last year in Canada, where nearly 50 million acres of wildlands burned, got the attention, I would say, of folks across the country. And of course, you guys have, in those living in Idaho and in the Western United States, have been dealing with this year in and year out for many years. But for those on the Eastern Seaboard or in the Midwest, last year was really quite an alarming situation for reasons which I'll describe shortly. And as a lung doctor, I can say that it was really quite eye-opening on a very individual level as somebody who sees patients, every day in the clinic and in the intensive care unit. The impacts of the health impacts of wildfires and climate change were pretty much inescapable. And as Dr. Sadegh outlined, the smoke impacts, of course, are most acutely felt in those who are living in communities directly affected by the fires. But of course, where the concentrations of smoke and other pollutants are highest. But smoke, as we know, doesn't just stay locally. It travels, and it travels across the continent, and it's been seen as far away as in Europe from some smoke that's generated in, say, in Canada. And while some of the toxins that are generated locally may be somewhat dissipated as they reach, farther thousands of miles away, many of the particulates and dust that are suspended in the air continue to have negative health outcomes, far away. And I will show some data to suggest that supports that assertion. Last year, I teamed up with a team from Michigan and some other universities around the country to kind of look at what's known about the respiratory impacts of climate change. And it was notable that among a very large amount of literature that has really exploded alongside all of the concerns about climate and health over the last decade, wildfires were really one of the best characterized and the most raised the most alarm among researchers and clinicians, and this was sort of represented by the amount of literature out there. The respiratory health impacts of climate change are quite complex, and in some ways still quite difficult to study, and that's because, like a lot of environmental exposures, when we breathe wildfire smoke, it's not the exposure is very much dependent on the proximity to the fire, what's being burned, and of course our own pre-existing conditions or respiratory health. It's important to note that wildfire smoke, is not like sort of your typical like campfire smoke. Well, that's probably not good to breathe either. Wildfire smoke really encapsulates a lot of really concerning chemicals depending on what's burning, and particularly when what's burning is along the wildfire-urban interface, when cars, houses, all kinds of man-made infrastructure burns. There's this complex cocktail of pollutants that are released, and as I mentioned earlier, are perhaps most dangerous for those who are in immediate proximity to the fire, but may spread well beyond that local geography. Of these toxins that burn, really the best characterized is particulate matter. And particulate matter, it can be a little bit of a confusing term in a way, because particulate matter, what does that mean? Well, it just means essentially just describing the stuff, the dust and liquid droplets that are suspended in the air and that are of a particular size. It does not describe it doesn't describe any specific compound, any specific chemical or pollutant. It's basically just what is suspended in the air. But we know that the amount of particulate matter that we breathe in, the concentration of particulate matter, particularly the really small particulate, that which is less than 10 or 2.5 microns, is very, very harmful. And it's particularly harmful when it's this really small stuff, because of course that is what gets inside of our alveoli. And when we're talking about even ultrafine particulate, that's what can even traverse into our bloodstream. And this has been known for decades, really going back to probably around the time of the London fog, which was a terrible smog event that happened in England at the time of, in the middle of the 20th century, where basically there was a huge mass casualty event that happened as a result of a combination of environmental factors and man-made air pollution. So we've known that this stuff is really bad going back many, many decades. And over time, the legal limit for what the government wants requires for our air quality has been kind of ratcheted down as we've gained more information about the detrimental effects of particulate matter. And in fact, just in the last year or so, thanks to a lot of work from environmental epidemiologists and others, the government has agreed to actually tighten the particulate matter limits. It was reduced from 12 micrograms per meter cubed down to 9 microgram meter cubed as the annual average standard. So that's very, very important measure that was taken. But while these are goals, unfortunately, when we have wildfire events, despite a lot of efforts to try to reduce air pollution from all factories and cars and trucks, the particulate levels that occur when major wildfires happen can exceed like tenfold that of where the legal limit is. And so, for example, during the Camp Fire in California in 2018, the 24-hour levels exceeded 250 micrograms per meter cubed, whereas again, the 24-hour standard by the EPA and others it should be around 35. And again, the data to suggest that this type of air pollution from fine particulates is dangerous and in fact kills people goes back many decades. But perhaps probably the study that I think is one of the most important is this paper that came out in approximately 2019 in the New England Journal of Medicine. And what this paper showed, and the methods are a bit complex, but they studied the mortality effect, in other words, people dying, the rate of death in 652 cities spread across the entire globe. And they mapped it onto the concentrations of particulate matter of 10 micrograms and smaller and 2.5 micrograms and smaller. And the really important thing that this study showed and added to the literature was that even at really low levels of particulate exposure, there seemed to be a dose response curve. So there really doesn't appear to be any safe level of particulate exposure. Again, we don't, you don't need to be an environmental epidemiologist to realize that when levels of particulate get really, really high, like I said in the campfire, patients not only feel sick and have a cough and have watery eyes and have trouble breathing and even end up in the hospital, they die at higher rates. So this is really, really strong evidence to suggest that this type of particulate is not good for us. And as I mentioned, particulate is just sort of one aspect of the health effects of wildfire smoke. When man-made infrastructure and synthetic materials are burned and released in this toxic plume, particularly close to the fire, all kinds of nasty substances are released, including metal oxides, hydrogen cyanide, phosgene dioxins, and others. So what are actually these outcomes that are known to be that have been measured from wildfire smoke exposure? Well, there are a lot of studies, and some of them are somewhat conflicting. But in general, if I had to summarize, we know that the two most common chronic respiratory diseases in the U.S. are asthma and COPD. And it's been well documented that when folks are exposed to wildfire smoke, they end up going to the emergency room or get hospitalized for asthma exacerbations at higher rates. And depending which study you look at, the one I've cited here, it seems that older adults and women are perhaps at higher risk. And certainly those who have COPD, like many of my patients at the VA here in Ann Arbor in Michigan, there's some very compelling evidence that they too have increased hospitalizations and physician visits and concordant increases in need for rescue medications. Now, this was very, very clearly demonstrated last year, and there was sort of this rapid study that was put out in the Journal of the American Medical Association. The data is shown on the right of your screen. These investigators showed what happened when particulate matter levels shot up to above 100 micrograms per meter cubed. And again, remember that that is tenfold, almost tenfold higher than where they should be according to U.S. standards. And as you can see, these investigators look specifically just at New York City, which again is nowhere near where the wildfire smoke was originating, somewhere in Canada. And you can see that over those few days where the sky turned orange, asthma-related ED visits shot up. And of course, this is the impact was not felt equally across the city. And those places where there are more kids with asthma who already live in, say, poorer parts of the city that have been redlined and so forth, those are the areas of the city that were most acutely affected. So, this is very compelling data. And I briefly, looked up, in Idaho, there's been, as of last year, there's been data published from the CDC that shows somewhere around a 17 to 20%-ish, don't quote me on those numbers, increase in asthma emergency department visits during the days last year when there were wildfire smoke events. So, none of this probably comes as a surprise to anyone, but the data is really there. So what about select populations? And an area that gives me great concern as a dad of two little kids is children. While there's less evidence in children in general about wildfire smoke exposure, there are some very concerning data out there. One is that so before I get to the data, I would just mention that theoretically, one would be concerned about kids because, of course, they just generally spend more time outdoors than adults. They also breathe faster relative to their size, and so they basically exchange more air. But also, there's this paper that came out a few years ago in pediatrics that suggested that they compared basically particulate matter from wildfires as compared to particulate matter that was produced by kind of your run-of-the-mill combustion from cars and trucks and so forth. And this study suggested that when wildfire events occurred, that smoke was about 10 times more likely to result in an emergency department or urgent care visit in Southern California. So perhaps there's something particularly toxic about wildfires that is driving kids to the emergency department. Now, what about firefighters? And again, this one is also kind of personal because my brother-in-law is actually a wildland firefighter ironically, in Idaho, in Boise, and he was actually just deployed this past weekend. So what about firefighters or those who are outdoor workers? Well, it's again, these folks are of really high concern because they spend long periods of time very close to high concentrations of particulates. And there's no real easy answer. I mean, it's difficult to reduce that risk. It's suggested that those folks who are in close proximity to wildland fires over the long term have decreases in lung function compared to controls. And there's been some suggestion that there are higher rates of lung cancer and heart disease. What do we do about it? It's tough. Increased screening. But largely, the data would suggest that we need to do a better job of making sure that there are quote unquote administrative controls, basically strategies of how they can construct the fire line, wearing respiratory protection, although that can be very difficult in very, very hot areas where they're doing very physical labor. But it is an area of that really needs a lot more attention. Dr. Sadegh mentioned this, so I don't want to belabor this, but not only are there vulnerable individuals like children, older adults, of course, outdoor workers and firefighters, but also communities across the country are not affected equally. And this was a really elegant study from 2017 that tried to understand who are the folks who are most vulnerable to the adverse health effects of wildfire smoke based on their underlying socioeconomic and socioeconomic conditions and comorbidities. And what was really kind of striking to me was that really these areas in Appalachia and the southern United States, and including parts of Michigan where I live, these are places that have high rates of asthma, high rates of comorbidities. And so one can imagine that even though the wildfires may not, thank God, not yet be occurring in our region directly, even when smoke blows in, these areas are going to be disproportionately affected and vulnerable to the known health impacts of wildfire smoke. And I do want to mention, again, not to be to spend too much time on bad news, because there are a lot of good things that we need to be thinking about, and we can be proactive about this. But one thing that I think that gives a lot of us a lot of concern and worry about this whole thing is that, we've done just like a remarkable job over the last 50 years since the Clean Air Act was put into place in cleaning up the air. And as I mentioned, we've kind of every few years, we kind of ratchet down the legal limit or the legal level for air pollution, trying to bring that down. And by and large, we've done a really good job of that, particularly in the East Coast, closing coal-fired power plants, cleaning up cars. But right now, I think for many folks, there is major concern about these out-of-hand wildfires. And as I mentioned last year, 50 million acres burned in Canada. This year so far, I think somewhere around 7 million acres have burned just in the United States. We are, as a result, losing ground to climate change, despite our really great efforts to reduce air pollution overall and particulate matter. And as Dr. Sadegh again kind of alluded to, the number of people in locations with poor air quality has actually increased in certain areas. And this was a nice assessment. If you guys have a chance to look up, First Street is I believe a consulting organization that put out this report about a month or two ago, looking at kind of the air quality index value plotted over time, and showing that really we're at this inflection point right now. Oh, we've already reached actually a few years ago, where now climate change and particularly wildfire smoke impacts are now outpacing clean air regulations. And that's basically from 2004, we wiped away about 20 years of air quality improvements. There are also, unexpected health threats from wildfires. And just as an example, during the Camp Fire, one might not have, I wouldn't necessarily have expected this, but actually those who took shelter during that campfire, actually more than 1 in 4 of those folks who were evacuated ended up developing norovirus because there was just basically poor hand washing. There wasn't availability of clean water to wash hands. And so there are a lot of sort of off target, if you will, effects of wildfire events. And then there's the long-term risks. And these are, again, these are sort of not terribly well characterized yet, but there are real concerns about the carcinogenicity from releasing a lot of these chemicals locally. In this paper, which came out last year, found this known carcinogen called hexavalent chromium in the soil of areas that had been burned in California. This is likely because there's a chemical reaction that's happening when fires are burning so hot that this secondary pollutant is formed. Okay, so how do we counsel patients? Obviously, there's a lot of reasons to be concerned, but there are very, very good proactive things that we can do to help minimize the risk. First and foremost, always, I try to emphasize, you can't really help yourself if you don't know what's going on. And I am really surprised, and perhaps this is a lot less so the case in Idaho, or again, you guys are all more familiar with this, but in Michigan, when we had this wildfire smoke event last summer over a couple of different episodes, it was striking to me how little patients were aware or knew about what was going on, what the threats were. So I think we need to do a much better job, particularly in this part of the country, to get the word out, including to those people who may have limited access to the internet or cell phones. And so, trying to counsel our patients in the clinic, and I think that would be more reasonable for those living in your part of the country, I think is particularly important. Making sure that they have access to medications, especially if they have COPD or asthma, kind of knowing what to do when an exacerbation arises, to get help early, to not delay, to call the doctor, set up a telehealth appointment if possible. Those are, I think, really common sense things that can be done. It goes without saying that staying indoors is generally a good idea, and the California Air Resource Board has really good recommendations for how much exercise to do depending on the level of the air quality index, which is in large part to which the particulate levels contribute. But it really depends on the quality of your how airtight your house is. And so for a lot of folks who live in older houses, you know, staying indoors may not necessarily reduce the smoke exposure in the house. And so that's where having you know, a good new air filter on your on your HVAC system, and or using room air filtration can be helpful, at least to try to create a clean room in your house. In addition, it's really important to not create forms of bad air in the house. So trying to limit, you know, frying of foods or certainly smoking in the house. Those can really help mitigate the risk of bad air outside. There is some again, preliminary data on the use of air purifiers in COPD to reduce the risk of exacerbation and rescue medication use. And I know that of some ongoing NIH-funded studies looking at wildfires. Again, this signal was is not super strong, but there is some suggestion that using as long as you use your HEPA filter and doesn't just sit there, compared to a sham filter, it does seem to actually reduce the number of exacerbations. But I am certain that we will have more data coming out. A lot of these filters can be really expensive, but fortunately, you can make these DIY filters at home. Basically, just take a box fan and you slap on a furnace filter, ideally of this minimum efficiency rating of 13 or higher. And even better would be to take several filters and make a kind of this box around that air filter, which I can go over if folks have questions. And that can be a very effective way to clean the air in one portion of the house. And lastly, wouldn't be fair to talk about all this if we didn't mention, you know, the root cause, of course, and that's to cut carbon emissions and air pollution. And of course, there is such an imperative now more than ever, as you know, to reduce the global warming, which is of course driving the drought and the heat, which is then contributing to increased wildfire smoke. And I know that St. Luke's and many healthcare systems around the country are trying to clean up their own operations, reducing emissions related to building, from encouraging active transportation and cutting into the supply chain emissions. So those are kind of the things that I wanted to mention, and I hope I didn't run too much over, and happy to take any questions from the audience.
Thanks so much, Alex. That was outstanding and has triggered a lot of questions and topics for discussion. I am going to go to a question from Spencer Renfro, who says, going back to Dr. Sadegh's presentation, is there any data regarding socially vulnerable people exposed to wildfires in Idaho?
I don't know if anyone has done it or not, but I will not be surprised if what we see in Oregon and Washington is also what's happening in Idaho. The reason for it is, you know, Idaho wildfires are more similar to what happens in California that makes it different is that a lot of coastal areas burn frequently, which are also the wealthy population living in those areas. In Oregon and Washington, a lot of the exposures were in eastern side of the states, which are very similar, both in climatic and also in population demographics to what we have in Idaho. So I would be, you know, I can say that probably we are very close to what we see in Washington and Oregon.
Great. From Audrey K in the audience, and this is a question about COVID and its association with deaths. Could the deaths we saw in the heat dome in the Northwest in 2021 have been exacerbated by COVID? And I think we have some data that I put in the chat from the University of Montana that showed about a 6-month lag of increasing flu symptoms and severity of flu after a wildfire season that was bad. But I think COVID was not around when that study was done. And it's something that's troubling me right now. I see a lot of patients that come in that seem like they have COVID, their COVID test is negative. Is it just wildfire smoke? I don't know. And how do I know? But I think the question from the crowd was specifically about exacerbation of deaths from heat and smoke due to COVID. Which came first? Is it COVID making the other symptoms worse, or are they sicker from the other stuff and it's making COVID worse?
Yeah, that's a great question, and I don't know specifically about the data in during that terrible heat wave in the Pacific Northwest, but I would say that there is pretty compelling data that the other way around, that those who are exposed to wildfire smoke and particulate exposure may have had worse outcomes with COVID during the peak of the pandemic. But I think that's a great question. It's hard to tease apart necessarily, and of course, yeah. I mean, a lot of the research, I will say that in our research as well here, it's dealing with the COVID pandemic has been real challenge, because of course, and isolating that as a confounder is really tricky. So you raise a great point.
Let me just add very quick note here. So there is a whole literature on a concept called compound extremes. The compound extremes is when you have two extremes, two drivers that each have an impact. But if you add the two impacts together, whereas both of them happening will have a much higher impact than the cumulative impacts of each one of them separately. And that's what we also see in COVID and a lot of other things, is that the cumulative impact of COVID and another factor happening is a lot more than each one of them separately or added together.
Okay, from Dr. Bart Hill, most of the public follows apps like the AQI or follow apps for the AQI. What evidence exists for the various AQI levels and risks to specific groups for those exposures?
Yeah, that's well, I know, Dr. Sadegh, do you want to take that one, or either way?
Go ahead, please.
I can comment in general. So I think this gets to another perhaps follow-up question from the same audience member about or perhaps from another audience member, excuse me, about smelling smoke versus local AQI updates. I think those are really good questions. So we have to remember that the air quality index, right, is a composite of several air pollutants, and they are measured often at discrete EPA sites, which are in certain areas around the community. But those do not necessarily reflect exactly what's going on where you are, particularly, like, for example, if your house is near a road, alongside a road, or you live, I don't know, in a dusty field or something. So you really have to take it, it's a helpful indicator. But like, if you smell smoke, all the guidelines would say, like, trust your instincts. And so while I use it as a helpful tool, but unless you have like an air quality monitor, like a purple air monitor, like along, that you're holding in your room, the air quality index doesn't necessarily reflect exactly what's going on where you are. So yeah, I mean, I think my advice here is to trust your instincts, and sometimes we can't quantify exactly what's going on where you are.
A question from Dr. Souza that I'd like to add on, and this is something I'm really interested in as a parent. Could you comment on the potential or hypothesized chronic effects of inhalational exposure to wildfires? He's asking about beyond pulmonary impacts, but I would like to know about pulmonary impacts as well. One of my concerns is my kids go out every summer and spend 2 to 3, maybe even 4 weeks breathing in smoke at summer camps. Is this effectively like them smoking cigarettes all summer long? And are we going to have a generation of kids growing up in the Northwest that all end up with COPD? And beyond pulmonary impacts, are there other medical physiologic impacts that we may need to watch out for in the long term?
Yeah, those are, I mean, really, really good questions, and unfortunately ones that I don't know that we can necessarily answer yet. It is of concern, of course. It's I would say it's more a hypothetical concern that because kids' lungs are developing up until the age of around 20, actually, that that period of growth is particularly vulnerable to the effects of wildfire smoke, and that there could be stunting, in growth of the lungs. We know that we've learned in the COPD literature that really these growth trajectories are really complex, and I would suggest those who are interested to look up the work of Meilhan Han, who happens to be a really phenomenal COPD researcher here at University of Michigan. But she and colleagues have really described how in the development of COPD, there are those who have genetic predisposition, there are those who have early childhood exposures, and then there are those who develop it for other reasons, from smoke exposure and so from cigarette smoking and so forth. So it's a very, very complex question, and I don't think it's one that we can really fully answer. What's best studied are the acute effects. Hospitalization, emergency department visits. Those we of course know. But I would say that my common sense answer as a dad too is to say, yeah, I mean, we want to try to limit exposure to smoke. At the same time, like, kids have to be outside too. And so we take the best precautions we can, try to limit that exposure on days when the air quality is really bad. But it's a trade-off that we have to make, unfortunately. So.
Great. So we are past the 1 o'clock hour. We do have a few more questions. If you guys don't mind sticking around and answering a few more questions, totally understand that people need to go, but we'll keep going for a few more minutes to try to get through some of these other questions. One question I have, in the Treasure Valley, the Air Quality Board for Ada County was shut down. As we saw the trend you referenced, Alex, where vehicle emissions were getting so low that we essentially felt like it was not necessary to continue testing. So we're not testing in tailpipe emissions anymore. And that was really the main function of the Air Quality Board. Now we're seeing this, explosion of PM 2.5 as the biggest threat to air quality. Is there something cities and counties and even states can do to reduce their state risk and exposure to this significant wildfire smoke? And what do you recommend from a policy level that these cities and states can pursue?
Yeah. So a couple things. One is, caveat being I'm just a simple lung doctor. I'm not a policy expert, but from my standpoint, I would say that I think that local communities, it's at least as in our community in Ann Arbor, which of course is relatively affluent and perhaps not all communities can afford this, but we've set up our own citywide air quality monitors. And I think having the data is really powerful, and to help convince policymakers to make changes. The other thing I would say just generally, and forgive me if I'm not answering the question directly, but I think that it's really important to have action plans for schools and for community centers for like what to do when the air quality does get bad. And I was really surprised to know that even in our like quote unquote progressive community here, like really we didn't have a great plan, and that it was very hit or miss. Like certain schools had certain plans, other daycares, for example, didn't. It just depended on like the leadership of that particular school. So having citywide, regional action plans, I think, is really important. And I think we lean heavily on what California has done. I mean, California is so far ahead of everyone else in the country, I think, in terms of emergency disaster planning, specifically for wildfire smoke. So I would reference, what I often do is direct folks to look at, what California Air Resource Board and others have put out for action plans for kids. Again, all of that, like a lot of those materials exist and are really helpful.
Nancy Cheney just posted a question. Dr. Rabin, your brother-in-law, firefighter, commented on similarities or differences between respiratory protective training and equipment availability at fires across the country. Like, are different fire camps seeing different things or getting different training? And, you know, kind of a follow-up to that, do you know, are we working towards better protective equipment that's better tolerated for people that have to be outside in times of smoke? You know, it seems like no roofer is going to wear an N95 mask. No farm worker is going to put an N95 on. And I've heard numerous stories from people that are wildland firefighters about just it's impossible to wear the protective gear because it gets so hot and hard to breathe. Do we know if there's any teaching or training or devices that are coming down the pike?
I wish I were more informed on this, Nancy, to be able to comment more thoroughly. But from my anecdotal experience, as you have, Ethan, similarly, and I have friends who work with actually coal miners, similar issues. It's basically virtually impossible to wear a respirator, high quality particulate respirator in these environments. So I think the things that are really most important are as I mentioned in my talk, administrative controls, trying to get people like out of this direct smoke area, planning ahead, and minimizing that direct exposure as much as possible. And when the air quality is so bad, to get people out of that zone of danger. So I think, unfortunately, there's no like scuba gear that you can put on as far as I'm aware that would protect you and also, you know, cool the air, which would make that kind of work feasible, at least not that I'm aware of.
Moji, any thoughts?
Well, what comes to my mind is some of these N95 filters also have fans in them. So I think that can help. And as we have more technological advances and have all these better batteries that can last longer and they're smaller, we might see some breakthroughs there that can help.
Yeah, thank you so much to was it Murphy who posted that San Francisco Chronicle article. Yeah, there's really a dearth of protection for these frontline workers, and it is really concerning. As of course we're gonna, I think at this moment in time, my brother-in-law mentioned I think there's something like 27,000 firefighters deployed right now in the country. So it's a lot of people who are rotating in and out. So
yeah, a question from Murphy about the complexity of smoke and evidence of things like neurotoxicity related to smoke, and how controlled burns are an important tool to address the wildfire crisis. But how do we thread that needle where we, you know, raise consciousness about the danger without jeopardizing our capacity to put beneficial fire on the ground? I think this is one that, you know, someone who came from New Mexico, where the largest fire in New Mexico history was a controlled burn that became uncontrolled. It's an important one to know. How do we deal with these things without, you know, something that's a natural cycle that we've got ways to help deal with it, but can sometimes get out of control.
Yeah, honestly,
any
Ethan,
thoughts?
I would lean on you to. I think you're probably more knowledgeable than I am in this, but I know that there is evidence about neurotoxicity and specifically there's preliminary evidence of increased risk of dementia, exposure to wildfire smoke. But yeah, I guess I would kick it back to you, or Moji.
Moji, any thoughts?
Well, I think that there is an increase in acceptance of lower levels of smoke that's coming from prescribed burn in recent years compared to what we had a couple of decades ago, because people are just aware that the fuel that's in the forest, in the shrubland, grassland, it has to burn. That's the natural cycle. So either you will burn it when the situation is not so intense that it will go out of hand. That produces less smoke, less thick smoke, shorter durations, or you leave it to be burned by a wildfire, which will be a lot more disastrous. And then the other thing is, yes, the controlled fire in New Mexico went out of hand, but there are plenty of other examples of these controlled burns that were effective, and they basically delivered. So, at the end of the day, this is part of the risk. If we don't risk it, we're gonna have to face worse consequences. So we might as well just risk it now.
Yeah, and it seems like the smaller smoke exposure dose you get from controlled burns doesn't really affect population health to any degree like the out of control large burns that we're seeing, because we're not getting those big plumes and bad AQI days when controlled burns are happening. And when those fires get out of control, that's when we're definitely seeing it.
And there is quite a bit of modeling before any of those prescribed burns or controlled burns go into place, right? So they model where the smoke is going to be, who is going to be impacted, what's the level. All those are already, every one of those treatments need to go through a NEPA and all sorts of, requirements are there for them to be approved. Air quality is one of those.
One question that's come up a lot for me in talking publicly about this is how are we in healthcare developing better preparedness for these times when we're seeing increased patient populations affected by smoke and heat. I think one thing that is a challenge that my colleague Terry O'Connor, who sadly passed away earlier this year, really advocated for was defining ICD-10 codes better so physicians can actually diagnose patients with the appropriate conditions so that we can get better data, so that we can know when to be better prepared. I just had a patient 2 days ago that is living in Garden Valley, an area that has an active fire going, who was sick with likely fire exposure and heat exposure and exhaustion. And the closest thing I could diagnose her with was air pollution, effects from air pollution. There wasn't anything for wildfire smoke that accurately described what's going on. So Emoji, I know you mentioned using ICD-10 codes as part of your research, and Alex, you're applying those. Do you know of any changes to the ICD-10 or ICD-11 coming diagnostic manual that would allow us to do this better?
I am not aware myself. Yeah, I'm not sure.
And how do you deal with those patients, Alex, if there's not something like that?
Yeah. Well, I mean, I think ultimately, and again, you guys are much more experienced than I am, coming from this part of the country, but ultimately we treat the exacerbation of respiratory disease like we would any other. I think having additional information and preparedness is really important. So folks know to get help when their breathing gets difficult. Again, a lot of folks will kind of just, especially my veteran population, just kind of just brush it off, and say, oh, it's just harder to breathe, but then it turns into something more severe. So I think acting early is really important. And as far as coding for it, yeah, I mean, it's totally inadequate. And so the research that we're doing, it's very, very, we can't rely on the quality of that administrative codes to be able to research it, at least not to my knowledge at this point.
I want to try to get to two last questions. We only have 2 more minutes, then we're going to shut things down at 1:15. So quickly, do you think that the school limit for athletic events of an AQI of greater than 150 is the right threshold? Is that limiting students' participation in athletics too much, or is it not protecting our kids enough, or is it is it the right thing?
I think that's a pretty pretty reasonable threshold. You know, it again, it depends a little bit on the duration and intensity of the exercise, and of course on the child's, you know, underlying health. And again, how frequently that's happening, how frequently are achieving that, are hitting that threshold. I mean, without, you know, really impeding the kids, you know, ability to do sports and enjoy, you know, to get physical exercise. So, I think it's probably reasonable, but I would encourage the questioner to look up as I said, the California I'll try to pull it up shortly and put it in the chat. The guidelines for which I think are really excellent for school activities for kids.
Yeah, it's just tough. We've had, you know, basically 2 to 3 weeks of all of preseason for high school sports, where the AQI and the heat have both been unsafe, probably, and schools are reluctant to shut anything down.
Yeah.
So, you know, am I doing the right thing as a parent, letting my kid go to practice, or am I condemning them to a future of chronic lung disease?
Right. Right. I mean, I will say that, like, we should all be very concerned about wildfire smoke. I mean, I don't want to minimize that in any way. We should be very, very concerned. And also, you know, if they're, you know, as you said, like, we don't want to necessarily overreact in some ways and prevent kids from doing sports and physical activity, because we know that also has a lot of detrimental effects on our kids and their mental health and so forth. So it's a lot of it is like what we dealt with COVID, you know, when is it safe to go to school with COVID in the community? And so it's a personal, ultimately it's kind of a personal family decision, but you know, we use the best evidence we can and try to guide schools.
Just one last question I want to get to for both of you. One takeaway you'd give to medical students or graduate students to take forward in their careers, from one of our medical students here in Idaho, who is also an engineer, Teresa.
Well, I mean, I think I work with a lot of students here at the medical school, and you know, who are so alarmed, passionate, whatever adjective you want to use about the climate crisis and the impacts on health. And there are so many, and students really motivate this work and often are the inspiration for many faculty, really, and research projects. So and there are really infinite ways to get involved, whether that's through clinical work, through research, through advocacy. And so I think it's really important to find a mentor who shares your passion and who wants to support you. And I think you know, banding together, forming groups with other students, working together, I think that's really the joy of this work, and helps me deal with my own climate anxiety, which is quite severe. So.
Very quickly, I just want to share that, you know, there is a lot of negativity. Obviously, trends are all negative, all those stuff. Be hopeful, right? The humanity has gone through a lot, and it's going to go through a lot. Just be positive, be hopeful, think about entrepreneurial, because you're on the ground, you're seeing all the impacts, and think about the ways that you can change things, you can develop, engineer, whatever you name it, that can help everyone. So be positive, be hopeful, and think about solutions.
Yeah, and I'll just close with my 2 cents that action is the antidote to despair. So get involved, and that has been the biggest way that has helped me cope with my climate anxiety. So get involved, be active, find something you care about, and you know, make it part of your career, make it something that's separate from your career, but get involved and do something that gives you some license in the face of a gigantic problem that we're not going to be able to control altogether. So with that, I'll say thank you so much to our two outstanding speakers and invite everyone to come back in a month to hear our next talk on sustainable design in hospital systems to help combat some of these changes that we're talking about today. So thank you all for your attendance, and Drs. Rabin and Sadegh, thank you so much for your expertise.
Thanks for having us.
Thank you so much.
Thank you.